Breastfeeding is a special time for a mom and her baby. While many moms face challenges, with patience and support, they can be handled, letting you enjoy feeding and caring for your baby. Here are some common problems when breastfeeding your baby. Sore nipples are common for breastfeeding moms and can happen if your baby does not latch properly. To help, make sure your baby's mouth covers both your nipple and areola. After feeding, applying lanolin cream to your nipples can help soothe the soreness. Earth Mama organic nipple butter helps moisturize dry skin and soothe sore nipples with a smooth, plant-based formula that's organic and cruelty-free. Cracked nipples usually mean your baby is not latching properly. Make sure your baby has a good latch. If your nipples crack, contact your healthcare provider for help. Engorgement happens when your breasts get too full and swollen with milk, causing pain and making it hard for your baby to latch. To prevent this, nurse often. If you experience engorgement, try a warm shower before feeding to help with milk flow. Gently massage your breasts and express a little milk to ease the pressure. Mastitis is a painful breast infection that causes breast tenderness, swelling, pain, burning sensation, fever, and shivering and chills also occurs. It can happen if milk ducts get blocked. To treat it, keep breastfeeding or pumping. Sometimes babies do not want to nurse, which can be frustrating for moms. This might happen because of things like fast or slow milk flow, teething, or distractions. To help your baby nurse, try creating a calm, quiet space with no distractions. You can also try different nursing positions or nurse in a dimly lit room. Breastfeeding pillows make the mother's position feel more comfortable and relaxed while breastfeeding. Boppy nursing pillow provides ergonomic support for breastfeeding, bottle feeding, and bonding. The C-shaped design supports different feeding styles like cradle, cross-cradle, and bottle feeding. If baby is not feeding well at the breast or breastfeeding continues to be painful, seek advice from a midwife or lactation consultant as soon as possible.